Hello everyone. So in today's video, I'm going to tell you about the most important questions or most important points regarding FMG exam. So for this type of questions, I use to term MTR like mujhe to ratna hai, or in English we can say I have to learn it for FMG. Now, in this of my flashcard, first question is about the agon string appearance. This appearance is seen on chest X-ray, and we have to identify it when we see egg on string appearance like this image. Then it is seen in transposition of great arteries TGA, and for this we have to give the surgery. We have to do the surgery, that is Jatini repair. So please remember that egg on string appearance is seen in TGA, and for this surgery name is Jatini repair. So these both three are questions regarding FMG exams, or you can take NEET PG exams. Okay. Now the next question is figure of eight appearance, because most of the students used to forget all these like adult string appearance or seagull appearance like these. Only we have to forget. So for this, please remember that figure of eight appearance is seen in TAPVC, total anomalous pulmonary venous. Okay, now the goose neck deformity. Here we see goose neck deformity. We have to see goose neck deformity on chest X-ray in endocardial cushion defect. Please remember it. Endocardial cushion defect. We used to see goose neck deformity. So these three are most important questions, because the rest of the congenital heart defect like PGA, we see the boot-shaped heart. So all, and in Epstein anomaly we see usually box heart shaped heart. So in these conditions we used to mostly we already remember, but these are the 3 points where we can forget, like the gooseneck deformity and agon string appearance. Agon string appearance is seen in transposition of great arteries, while gooseneck deformity we used to see in the endocardial cushion defect. Okay, now in the next question, the drug of choice, because I used to forget and I used to prepare these flashcards during my FMG preparation, which I already cleared this Jan 2024 in my first attempt, and I hope these flashcards are also useful for you guys also. So that's why I used to prepare these flashcards. So for the rickettsia and vibrio cholera, the drug of choice is tetracycline or doxycycline. So please remember the drug of choice for rickettsia or cholera is tetracycline. Now the next one is the next one is the osteomyelitis. So, which drug has the side effects like osteomyelitis? That is the BCG vaccine. So, BCG vaccine has side effect osteomyelitis. Please remember this question also in respect of pediatric, in respect of PSM, because in vaccine topic they used to ask like which one is the side effect of which drug. So, for BCG vaccine, osteomyelitis is the side effect. Now in my second flashcard, like just behind it, I wrote my like uppermost, middle and lowermost part of uterovaginal. Like suppose this one is our uterus, okay? Now behind the uterus we have the rectum, and in front of it we have the gallbladder, okay? So this one is our gallbladder. So uterus, rectum and sorry, not gallbladder, urinary bladder. So this one is the urinary bladder. So when there is uppermost fistula is seen, like if they are dripping is seen in uppermost part, then there is possibility of uretrovaginal fistula development. Uretrovaginal fistula, because suppose this one is our urinary bladder, and in it we have our ureters which used to come and drain the urine in our urinary bladder. So if there is, and behind it we have rectum. Okay. So when it is in the uppermost part, it means the uretrovaginal fistula will be there. So in the uppermost part, uretrovaginal fistula. Well, in the middle part, it is vesicovaginal fistula. Okay. So in middle part, it is vesicovaginal fistula, and in the lowermost part, if it drain in the urethral part, then it is uretro uretrovaginal fistula. Okay. So uretrovaginal fistula, in the urinary bladder, vesicovaginal fistula. while in the ureter it is ureterovaginal fistula. Okay, so when the fistula develop, if the fistula develop here or here or here, then it is the uppermost, middle, and lowermost part: ureterovaginal, vesicovaginal, and ureterovaginal. And the audit is the quality of medical care. So what kind of quality is given in the medical care? That is the audit. So you can see most of the questions in PSM subject about the audit quality of medical care. Now, which test we have to do in which trimester? This is also a very important question. Like in the first trimester, we used to do double test, pap test, and FCG. Please remember pap test is done in T1 and double test is also done in T1 trimester. While the triple and quadruple test we have to do in T2, means second trimester. So T2 in second trimester we used to do triple test and quadruple test. Also, please remember what are the tests being performed in triple and which type of test is coming in quadruple test. Like inhibin test is included in quadruple test. Okay. Now FSH and LH, which cell? So FSH is released by Sertoli cells and it releases the inhibin, while LH releases the leading cells and it releases testosterone hormone. Okay, and also this one also two important points like Neisseria meningitis. Just reverse the M. It look like W, and from W it starts. Waterhouse-Friderichsen syndrome is caused by Neisseria meningitis, while Neisseria gonorrhea causes the Fizhou-Curtis syndrome. Please remember these points also because I always used to um, jumbled these questions like in Neisseria meningitis. I used to thought about Fitz-Curtis or something else, but please remember that Neisseria meningitis does Waterhouse-Friderichsen syndrome and Neisseria gonorrhea does Fitz-Curtis syndrome. So these are my flashcards. These are my two flashcards. I hope you enjoyed this series. So uh, we will see in next video. Okay, bye bye guys.